main story this morning, the proposals to create a two-tier system for A&E departments in England, a review by NHS England's medical director, Sir Bruce Keogh, suggests up to 70 major emergency centres should treat the most serious cases, and then smaller centres would look after the rest.
Well, Sir Bruce told Breakfast that changes were needed to give patients a better medical outcome. So let's discuss this with Clifford Mann from the College of Emergency Medicine and Andy Proctor from the College of Paramedics. Very good morning to you both. Clifford Mann, I wonder if we can deal with a couple of these proposals. Firstly, that there would be a two-tier system. And if, for instance, you were suffering from stroke or heart attack, you might be taken to a smaller number specialist A&E centres. If that were the case, presumably the concern raised in some people's minds, longer journey times and not going to your local A&E department. Is that a concern?
Well, I have to say it's not really a concern because this system is already in place over most of the UK. Currently, if you're the victim of major trauma, you have an obvious heart attack or a stroke, then you will be taken to a hospital that is best equipped to deal with it, even if that means bypassing the nearest hospital. And there's good evidence that by doing that, the outcomes for those patients are definitely improved.
Okay, so that's from your point of view, that is a welcome proposal that could see medical benefits.
Yeah, except it's a proposal that's already happening, so I don't think that we necessarily need to think about what we're going to be doing in 3 or 5 years on this proposal. It currently happens, and there could be no clinical objection to that continuing to happen.
Andy Proctor, one of the things Sir Bruce Keogh is talking about is a greater role for paramedics as part of the effort to keep people away, in essence, from A&E. Is that a practical suggestion?
It certainly is. We welcome the report because it stipulates just how important and key paramedic role has been in patient care, and the role that potentially paramedics could have even more in keeping patients at home, giving them the right care, and ensuring that they can bypass A&E and go to the most appropriate units through specialist roles such as specialist paramedics.
How much of a gap is there, though, between the medical knowledge that a paramedic would have and, say, a fully qualified nurse or a doctor?
Not that much of a gap at all. Paramedics work autonomously, so they're able to make decisions on their own through using a range of different resources to ensure that the patients get the right care in the right place.
Yeah. Clifford, we have heard so many warnings, haven't we, about this winter putting extra pressure on A&E departments. For you, what are the key things that need to be done very shortly?
Well, that's quite straightforward. The first is we need these credible alternatives for people attending their local accident and emergency department, and without that, patients have little or no choice but to default to A&E, which can't continue to happen. Secondly, we need to turn around the recruitment and retention crisis into accident and emergency departments, because without a credible workforce there and without sufficient numbers of people, then patients will have to wait longer and longer and outcomes could potentially worsen, and that's not a situation we would want to endorse.
But you agree that, sorry, I was going to interrupt there. So what about the 111 service, which is coming for a lot of criticism? So Bruce talking about reinforcing that. What needs to be done there, do you think?
Well, I think the proposals for the 111 service are commendable. They want to increase the amount of clinical input into that service, and in particular, and most importantly, they want that service to be able to book appointments for patients to see clinicians other than their A&E team. So they would be booking appointments with their general practitioners or other general practitioners or other out-of-care workers. And were that to go ahead, we would be strongly in favour of that.
Andy Proctor, do you think that paramedics need more powers under new proposals?
Yes, there's a significant place for paramedics to have the ability for further training, and also we really need to push the independent paramedic prescribing, so paramedics are able to prescribe patients medication at home.
Are you not able to do that at the moment?
No.
No, and you're not able to hand out any drugs at all?
We are able to give drugs under patient group directive, but not under independent prescribing, and that's something we're really keen on pushing.
All right, thank you both very much indeed.
Andy Proctor and Clifford Mann. 17 minutes past 8.